Hi, I'm Via Ryerson, a 9-year-old Time for Kids kid reporter in Philadelphia, Pennsylvania. I'm here with Dr. Janet Woodcock, the acting commissioner of the Food and Drug Administration. So nice to meet you, Dr. Woodcock.
Great meeting you.
What are your responsibilities as the acting FDA commissioner?
Well, I'm in charge of making sure that everything runs at FDA correctly. FDA is in charge of like all the medical products like drugs, uh, testing, vaccines, blood, biological products, as well as food and cosmetics and feed for animals and animal medications as well. So it's a lot of different activities and different commodities that we make sure they're safe and that are also they work.
So the big news this week is that the FDA authorized emergency use of the Pfizer COVID-19 vaccine for kids 5 to 11. Then, the Centers for Disease Control and Prevention said that shots can begin as early as this week. I've waited for months to get vaccinated, so this is big news to me and also other 5 to 11-year-old kids and their parents. What does this mean that the FDA authorized emergency use of the Pfizer COVID-19 vaccine for kids?
Sure. Well, the emergency use is a special way that we have that Congress provided when you have a public health emergency like we do with the pandemic to get things out quickly, but with the same level of scrutiny, of carefulness and looking at all the information and everything that we would for a regular approval. We looked at all the data on the pediatric vaccine on the 6 to 11-year-old kids. We looked at safety, we looked at the effectiveness. We had an advisory committee meeting and got expert input, and those advisors voted very, very positively that kids this age should get the vaccine. So that's what the emergency use authorization is about.
What side effects should kids expect from the vaccine?
Well, when you get a vaccine, it's a shot. And so the most common side effect you might have is a sore arm, right, after your shot. And some kids may feel like they have a mild flu, like for a day after. They might feel tired, have a little fever and chills a little bit, perhaps have a headache, symptoms like that. But usually these are gone within a day or so, and people feel just fine after that.
What was the biggest challenge of working on approving the kids' vaccines?
Well, I think that the challenges are, of course, it's challenging to get kid volunteers and do the studies in children. Like most people, children don't want to be stuck with needles and have their blood drawn and so forth. But we got child volunteers and those kind of tests were done. One of the challenges, I think, is that there is belief in some parts of the country, and some people are very concerned or hesitant about vaccines and are reluctant to take them. And that's even more common as it comes to children compared to adults. And so, of course, you have to really assure yourself of the safety of these and that you are evaluating them very carefully to make sure that you understand what the side effects might be.
Will kids getting vaccinated against COVID-19 help end the pandemic?
Likely that is so. We don't know enough about this virus to say what actually we need to do. But we know one thing is to have a large amount of the population not getting sick and going around and spreading the disease. We don't know yet how much vaccination prevents transmission. In other words, people might still acquire the virus and actually be able to spread it to other people. But we do believe a high level of vaccination will help end this pandemic, and that people should be protected down to young ages.